what is minimally invasive spine surgery? What do we mean when we say that? I'm going to just start down the panel here with Dr. Wang.
Minimally invasive surgery can be a philosophy. It could be a principle of saying, well, when we look at the spine, because the spine's so vast, I'm going to do the least amount to the spine that will get the job done and make the patient better. It can also be technically oriented. For example, there are specific techniques and methodologies used that make that more possible, right? But the reality is that it is a concept where you're trying to reduce the amount of collateral damage in the process.
Traditional spine surgery was done through large incisions through the back. It involved typically stripping the muscles off the spine to get access to the spinal structures, and then doing delicate work around the spine and around the nerve structures. The downside of that was a lot of the post-operative or after-surgery pain, discomfort, recovery was related to that extensive muscle dissection we would do, and really we were only doing that to access the spine. So minimally invasive surgery really evolved around finding ways to access the spine, do an equally good job as we had done with open surgery, but as Mike said, without all the collateral damage. So some patients like the idea of very small incisions, which we do, but to me, much more important than the small incisions, which are sexy, is the fact that we really preserve the structures around the spine, and with minimally invasive access, we can really do exactly what we need to the spine without damaging structures that just happen to be in our way. So that's really how I see minimally invasive surgery and how it's evolved over the last 20 or so years.
Yeah, that's really incredible. And that idea, Dr. Phillips, of having a small incision is really what the patient sees, and the patient doesn't see, the tremendous amount of technology that goes into making it really small, and the amount of work that goes in that's been shrunken down to just result in just that one little scar that a patient is going to have. It's really quite remarkable. Dr. Anand, give us your description of minimally invasive spine surgery.
I agree with all that's been said, and I'll take a little twist on that, in that I know we get fixated on the incision, and I think Frank sort of alluded to that. To me, it's not the incision. The incision, skin heals end-to-end and side-to-side. If anyone's at a facial lift, it is a very big incision, but nobody knows that, right? So I think it's the tissue damage that matters. To me, minimally invasive is about trying to do as little tissue damage as possible, maintain your muscles, as little collateral damage as alluded to before. And so what that means is find tissue planes. We don't have to operate through muscles. Find a plane between the muscles. Get down to the do it. We have technology that helps us. We have robots, we have tubes that allows us to access that. So I think we work together with a philosophical way of approaching the spine, and then use technology to help us get there. But I'll just take the twist in that we should not focus only on the incision. But just because you got a 1/4-inch incision, you do a horrible job, that's probably 10 times worse than having a 2-inch incision and doing a good job.
So I usually define minimally invasive surgery as sort of a toolbox of various techniques where we can use those techniques to optimize decompression, spinal stabilization, and spinal reconstruction, but at the same time limit the collateral damage like you've heard everybody talk about, so that we're preserving soft tissues to reduce risk, complication, and improve the recovery period.